definitive diagnostic test for cause of chronic malabsorption, intestinal biopsy, features of celiac disease, villus atrophy, crypt hyperplasia, inflammatory cells in lamina propria, maintained mucosal thickness, not a feature of celiac disease, increased thickness of mucosa, mucosal thickness is normal, cereals which should be avoided in celiac disease, wheat, oat, barley, rice, but not maize. Celiac disease is associated with HLA-DQ2, most common HLA-DQ8, second most common HLA-B8, HLA-DR3, HLA-DR7. Most common carbohydrate intolerance after infectious enteritis are lactose, tests for lactose deficiency and lactose intolerance in children, hydrogen breath test. Most common cause of neonatal cholestatic jaundice in newborn, idiopathic neonatal hepatitis, most common extrahepatic biliary atresia, second most common. Important features of extrahepatic cholestasis, e.g., biliary atresia, raised alkaline phosphatase, 5-nucleotides, and GGT. Important causes of extrahepatic biliary atresia, EHBA, alpha-1 antitrypsin deficiency, viral infections, Niemann-Pick disease, giant cells seen in neonatal hepatitis, EHBA, diagnostic procedure for extrahepatic biliary atresia, EHBA, percutaneous liver biopsy, common cause of portal hypertension in children, India, extrahepatic portal, venous obstruction, EHPVO, common cause of portal hypertension in child portal hypertension, most common cause of massive hematemesis in child portal hypertension, most common viral cause of diarrhea in children, rotavirus, important viral causes of diarrhea in children, rotavirus, calicivirus, adenovirus, astrovirus, Norwalk virus, not reovirus. Most common bacterial cause of diarrhea in children, ETEC, enterotoxigenic E. coli. Parasites causing diarrhea in immunocompromised child, Giardia cryptosporidium. Most common cause of abdominal pain in child, behavioral functional pain. Most common cause of abdominal pain in an infant, colic, evening colic. Evening colic usually seen in age group 3 to 4 months. Common causes of cirrhosis in children, viral hepatitis, HBV, HCV, idiopathic, neonatal hepatitis, biliary atresia, alpha antitrypsin deficiency, Wilson's disease, hemochromatosis, galactosemia, cystic fibrosis, parasitic, opisthochis, cystosoma, fasciola. Most common cause of gastroesophageal reflux disease, GERD in children, regurgitation. To diagnose GERD in children, regurgitation plus one of the following: respiratory symptoms / failure to thrive / poor weight gain. Double bubble sign in children, duodenal atresia, Ladd's band, annular pancreas, pancreatic head tumor, pancreatic pseudocyst. Childhood cholelithiasis is seen in Niemann-Pick disease. Most common cause, pancreatic pseudocyst in children, acute pancreatitis due to trauma. Most common GI malignancy in children, lymphoma. Causes of bloody vomitus in neonates, stress gastritis, hemorrhagic disease of newborn swallowed maternal blood. For anorectal malformation, X-ray invertogram is done at 12 to 24 hours after birth. Absence of stomach bubble on antenatal USG, fetal esophageal atresia. Homemade emetic agent for children in suspected poisoning, syrup of ipecac. Most common cause of vomiting in neonate, aerophagy. Most common cause of bleeding per rectum in infants, anal fissures. Most common indication of liver transplantation in children, biliary atresia. Dribbling and regurgitation after feed, respiratory distress, frothing and bubbling at mouth in neonate, tracheoesophageal fistula, congenital hypertrophic pyloric stenosis, CHPS, usually presents after 3 weeks, maybe as early as 1 week. Metabolic derangement in CHPS, hypochloremic alkalosis with paradoxical aciduria and hyponatremia, non-bilious vomiting with palpable mass in epigastrium, CHPS. Ramstead operation is done in CHPS, most common cause of acquired megacolon Chagas disease. Hirschsprung disease is due to defective migration of neural crest cells into mesodermal layer of gut. Most commonly affected region in Hirschsprung disease, rectosigmoid region, typical presentation of Hirschsprung disease, delayed passage of meconium, initial screening test for Hirschsprung disease, rectal manometry. Definitive diagnosis of Hirschsprung disease is made by rectal biopsy. Biopsy findings in Hirschsprung disease, absence of ganglia and ganglionic cells with thickening and hypertrophy of nerve trunk. Dilated segment of bowel in Hirschsprung disease is proximal to affected contracted segment. Most common cause of intestinal obstruction in neonate, jejunal atresia, most common, followed by duodenal atresia, second most common. Most common cause of intestinal obstruction in infant, intussusception. Most common symptom of small bowel obstruction in neonate, bilious vomiting. Most common cause of abdominal distension in intestinal obstruction, swallowed air. Investigation of choice of volvulus of sigmoid in suspected perforation, plain X-ray. Likely cause of intussusception in a child, Peyer's patch hypertrophy, bloody current jelly stool, abdominal distension, sausage-shaped palpable mass in child screaming with severe abdominal pain, intussusception. Inflammatory bowel diseases, IBDS in children, Crohn's disease, regional ileitis, ulcerative colitis. Commonest site of involvement in Crohn's disease, distal ileum, followed by colon. Skip lesions are seen in Crohn's disease. Pseudopolyps and toxic megacolon are features of ulcerative colitis. Lead pipe appearance on barium enema is seen in Crohn's disease, not a feature of neonatal necrotizing enterocolitis. Increased bowel sound. Bowel sounds are decreased or absent. Important features of necrotizing enterocolitis: abdominal distension, diminished bowel sounds, pneumatosis, intestinalis, pneumoperitoneum, metabolic acidosis. Treatment of choice for perforated necrotizing enterocolitis, paracentesis, peritoneal drainage, followed by